Hello and namaste. How have you all been? I do hope that you have been following all the precautions which will surely help you to successfully fight COVID-19. This is Dr. Srinidhi Chidambaram, and I welcome you to the COVID Care series presented by Apollo Hospitals. The COVID Care series brings insights on COVID-19 from a cross-section of our top medical experts from across the country. COVID-19 needs our full focus right now, but constantly observing ourselves for symptoms of COVID makes us quite anxious, panicky, and even paranoid sometimes. It is tough to find that right balance between taking all the precautions, being observant, and not overthinking and worrying too much about COVID-19. So the right knowledge is indeed the best way to stay calm and cool during this pandemic. Cough is a very common symptom that we all can get from any cause. It can be an infection, or it can be even due to allergy, or even an acid reflux, or even irritants like smoke or dust. But cough is also a COVID-19 symptom. So today we are discussing the topic, is every cough COVID-19? And I'm very happy to welcome Dr. Ram Gopalakrishnan. Dr. Ram Gopalakrishnan is an eminent infectious disease physician with an experience of over 33 years in this specialty. He practices at Apollo Hospitals, Greens Road, as well as Apollo Children's Hospital in Chennai. He completed his MBBS from the Madras Medical College and his MD in General Medicine from PGI Chandigarh and his MRCP in the year 1992. He is also a member of the Tamil Nadu Medical Council. Dr. Ram Gopalakrishnan, I am very happy to welcome you to our COVID Care series, and our viewers, I'm sure, are looking forward to hearing from you what it is about the cough. Should we relax, or should we check our oxygen saturation, or should we immediately rush to the hospital?
Okay, thank you, Dr. Srinidhi, for that kind introduction. So the topic we're going to discuss is cough, and is every cough COVID or is it something else? Now, we are in 2021, and sadly, we are in the midst of a second wave of COVID. So the answer to the question, is every cough a symptom of COVID or not, will vary upon the time. Had you asked me the same question, say 4 months ago, in say January, I might have given you a different answer. Now, because of the second wave sweeping across the country, there is a high chance that if you are coughing, you might have COVID. Now, how do you differentiate a COVID-related cough from other causes of cough? First of all, a COVID-related cough would be there for a short period of time. COVID is a respiratory illness. It's not a chronic cough. If you've been coughing for weeks or months, then it's highly likely that you have something else going on. It's going to be an allergy. It's going to be reflux. It could even be things like tuberculosis or other lung diseases, which you need evaluation for. But let's say it's not a chronic cough. It's an acute cough. It's been going on for a few days or up to a week at the most. So how do you know that whether you have COVID or something else? There are some symptoms which are very typical in addition to cough. These are, number one, loss of smell. If you've lost your smell, then you have COVID. The positive predictive value of that symptom for COVID is very, very high indeed. Similarly, if you suddenly lose your taste, you usually should also have upper respiratory symptoms. If you have COVID, you might have a blocked nose, you might have sinusitis, you might have a sore throat, you might have other symptoms of generally feeling unwell in terms of stuffiness, etc. These are all symptoms of COVID. The worst symptom that hopefully none of you will have is breathing difficulty. If you're having shortness of breath, then that means that in addition to having COVID, it's possible that your COVID has progressed as well, and that you may have moderate or severe COVID, which you need urgent evaluation for. So once you start coughing in May 2021, I think it's a good idea for you to presume that you might have COVID, because that is the safest approach. I would not have given you this advice certainly in the pre-COVID era, not even as recently as December, January, February, but with the second wave, the chance of COVID in somebody who has cough is exceedingly high. And if you have any of the other symptoms I mentioned, it's time for you to see your doctor. Now, just because you have cough and just because that cough may be due to COVID doesn't mean it's time to hit the panic button. What you need to remember that COVID is a deadly disease in less than 1%. And that number is far less if you're younger, say if you're younger than 60 years of age, or you don't have any other diseases like diabetes, blood pressure, coronary artery disease, or any of the other what we call comorbidities, which increase your risk. On the other hand, if you do have any of these other illnesses and you start coughing, then your index of suspicion for COVID should be higher. You need to see your doctor and you need a COVID test. So your approach to cough really depends upon your underlying host status. If it's a young person, a child, then chances are it's COVID, but there's a high chance that it's going to be mild COVID. You may or may not want to test. You probably should test, but if you're a young person who doesn't have easy access to a test, then that's fine. Just tell your doctor, stay in touch with your doctor, remain isolated, follow the usual cough precautions. All of you know how to cough, right? You should be wearing a mask. I'm not wearing one because I'm the only person in the room, but you should be wearing a mask if there's anyone in the room. And when you cough, you always cough into something. The ideal way to cough is to cough into your elbow because you don't use your hands as much. But if you can't cough into your elbow for any reason, at least close your hand, your mouth with your hand when you cough. So you prevent the virus from spreading all across the room and immediately use hand hygiene later. So cough, yes, COVID chances are high at this time of the year in 2021. But that doesn't mean you got to panic. The vast majority of patients with COVID have mild disease, especially if you're young, low risk factors. Just keep in touch with your doctor, give your doctor a call, in person, online, however you choose to connect with your doctor. Most often doctors will say test, but even if they don't test, stay isolated, very high chance that things will subside with time. Over to you, Srinidhi.
Also, are there any differences between a COVID cough and any other cough? Like, is it likely to be more productive or it varies? Because we normally hear of the dry cough, but we also hear of people saying that they're bringing out a lot of phlegm and things like that. So is there any pattern to the cough in?
So you really can't differentiate. One of the myths that we have in terms of respiratory infections is that if you're producing sputum, that indicates a pneumonia or a bacterial infection, etc. The production of yellow sputum, green sputum, white sputum doesn't differentiate a virus from a bacterial infection. And it's no different with COVID. The vast majority of patients, COVID behaves exactly like the flu or the common cold. It is a coronavirus. We've always had coronaviruses. So you can't differentiate based upon the type of cough. It's really the situation in the country that increases the likelihood of COVID.
I've heard of people who say they've started coughing or they've tested positive, but then even before they test positive, they start checking their oxygen saturation 3 times a day. So what is the recommended, when should you start looking at that? Some people say it's only on the day 5 or 6.
Yeah. Right. So when you start coughing or when you think you may have COVID, or even if you're tested positive for COVID, the danger symptom is breathing difficulty. In other words, if you're finding it difficult to take a deep breath, or if you find that you're breathing rapidly, or somebody comments, you're not looking good, you're breathing rapidly, you don't look well, or if you start developing symptoms of, say, coronary ischemia, you start developing chest pain or dizziness or syncope, those are all red flags. You need to see a doctor or get to an emergency room right away, because they could indicate that your oxygen levels are low. But the vast majority of patients who just check their oxygenation without breathing difficulty are just wasting their time. Now remember, pulse oximetry is recommended only for those with risk factors. In other words, if you are under 60 and you don't have other diseases, you don't need a pulse oximeter for the monitoring of COVID. If you're over 60, you have other diseases, yes, on the advice of your doctor, you should do pulse oximetry, but never go in for pulse oximetry like a temperature monitoring. It's not a temperature monitor. It is something that is recommended by your doctor.
And you don't need to check it if if you haven't even tested positive and you don't have symptoms. You don't need to routinely check it. I've seen a
Definitely not.
do that every day, like you check your height and weight.
Yeah, it is a test you need to do if you have COVID, either confirmed or clinically based upon a talk with the doctor, right? After that is when you start checking your oximeter if you have high risk factors on the advice of your doctor.
What do you do if the COVID, we also see, I myself have seen a couple of friends in the last couple of days where, they do have symptoms, and that might include a cough or might be a burning of the eyes or a light temperature, but they have tested on day 3 or day 4 and they have turned out to be negative. But at the same time, their symptoms continue. And they do have a persistent cough in many cases. So what should they do? Should they test again, or should they just wait it out?
Yeah, so that is when you need to have a chat with your doctor. So if somebody called me with the situation you mentioned, I would ask, are there patients who are coughing, or others who are coughing? Anybody else who's COVID positive among your immediate contacts, work contacts, home contacts, etc. If there is another person in that household or that work setting who's COVID positive, there's a very high chance that the index patient actually has COVID and the test has missed it. Now, we all know that the testing has its fallacies. If you test 3 people with confirmed COVID, only 2 of them will actually have COVID. So the test misses 1 in 3 persons. That's why it's important to put together a lot of factors. What is the prevalence of COVID in the community? Right now, very high, most parts of India. Anybody else with COVID in that household, etc. And then make a diagnosis of COVID or something else.
Is it true that in the second wave, is it just because of the larger quantum of tests, or there is some new strain of virus that evades the RT-PCR and turns out false positives?
No, the RT-PCR tests are quite good. The new mutants don't affect the testing. They may affect your vaccine response. They may affect your immunity and your risk of reinfection, but the test picks up the new mutant. So testing is not an issue. We may be testing less. We sometimes don't test because if an average patient calls me and tells me I have cough, 3 others in my family have cough. Yeah, you all have COVID. Yes, so treat as if you have COVID. So that's what I would tell a person who is young, who doesn't have risk factors.
Also, when people recover from COVID, they even after the 14 days, some of them persist in having some kind of a cough for almost a couple of weeks after that. Why is that, doctor?
That's because that's what all respiratory infections do since humankind. It is called a post-viral bronchitis. The natural history of any virus, whether it's flu or COVID or anything else, is acute fever, cough with upper respiratory symptoms, and then the airways remain reactive for a period of sometimes 2, sometimes 4 weeks. So, and the patients get very worked about that. I'm not getting better, but actually that's the least thing they need to be bothered about. After 10 days, they are not infectious to others. They can step out. After 10 days, they are not at risk for getting worse. So don't worry. If you're proven COVID beyond 10 days, you're probably home free. Don't worry. Don't worry about the cough.
Also, this brings me to another thing that we've been reading, all these mass steam inhalations and telling people that, you need to steam thrice a day. How useful are these? And they maybe not in preventing COVID, but are they helpful at all in reducing the symptoms? Or do they actually, when you put hundreds of things, including masalas and everything into it, does it irritate your respiratory tract more?
Yes, I actually would not recommend steam inhalation. We've had several cases, especially in children, of burns to the face because they, upset the hot water and it falls over their face. Steam inhalation doesn't do a lot for you at all. Okay, the natural history of COVID is resolution over time. It may give you some symptomatic relief, fine, but at what expense? You don't want to scald your face. So these interventions are not proven to work. If it's an adult who can use it carefully without burning themselves, okay, fine. But it's not something we generally encourage.
What about similarly the Betadine gargles? Because is that something that can also prevent if they have been out and then you come back and you gargle with that? And even in a COVID patient, does it help in any way is one question.
The only person who benefits from a betadine gargle is the company that makes the betadine, not the patient. So all you need to do is to say gargle in a little bit of warm water with saline. That will reduce the symptom of throat irritation. It's not a good idea to put chemicals in your throat. None of these things get rid of COVID. Remember, COVID is a systemic disease. It's there in your lungs, and you certainly can't put betadine in your lungs. You can only put it in your mouth and throat.
But salt water gargles may provide some relief.
Symptom relief, yes, because what you want to do is it's a self-limiting virus in the vast majority of folks. You just need to give them treatment to help with their symptoms, whether it's paracetamol for pain or fever, or if they have a very raw sore throat, using warm saltwater gargles is a reasonable thing to do.
But there's also a lot of these WhatsApp messages that have been going around telling people that it'll even prevent it. But I think people should understand that that doesn't, that might mislead you and stop you from wearing a mask, for instance.
Absolutely. WhatsApp can be downright dangerous, right? It's sometimes better to just read the newspaper. See, in the newspaper, they can only put stuff which is scientifically correct and vetted. Please don't go by WhatsApp.
But, people also like to read what seems, like easy or, like a bit something novel and not allopathic medicine. They love to read it. Well, the next question is about asthma and COVID. So there is a question as to what should an asthmatic patient do if they land up with COVID?
Right. So asthmatic patients historically flare up when they get viral infections, whether it's flu or well before COVID came onto the picture. So even a minor virus infection, which a normal person gets rid of in a couple of days, can trigger a severe asthma attack in an asthmatic. So if an asthmatic gets COVID, they need to double up on their regular standard doses of inhalers. They need to carefully monitor for breathing difficulty. The breathing difficulty may not be due to bad COVID. It may be just due to an asthma flare. And they need to be in touch with their asthma treating doctor so that they can be monitored. They don't go into severe acute asthma.
There's a question as to how to recognize a dry cough from a wet cough. I don't know what that really means.
Don't worry, they both mean the same. They mean you probably have a respiratory infection, which in May 2021 is almost certainly COVID. Doesn't matter whether it's dry or cough, it indicates that your bronchus is elevated. And it doesn't make any difference in treatment. If you're not having breathing difficulty, then don't worry about it.
There's something about having a loud cough that sounds like a seal bark accompanied by high-pitched breathing. Again, the question is it likely to be COVID? But you've already said that any cough in this season is likely to be COVID. So
absolutely. Right now, virtually every other respiratory virus has been wiped out by this guy. COVID is kind of the king of the country right now. So you're not going to get any other viruses. There's even a fall in TB right now because people stay indoors, they mask up. Certainly no flu activity at all in the country. So that's why if you have COVID now, if you have cough right now, you probably have COVID.
There are some more questions, Doctor. I'll just read them out one by one. These are from our live audience. If a person takes a first dose in between, the first dose of the vaccine, they want to know if they can have COVID in between, and when should they take the second dose?
Yes, that's quite a common scenario because we all started vaccines in February, March, and COVID hit around that time. So we have a whole bunch of folks who've just taken one dose. So the practical answer to that is, as soon as they get better from the COVID, when it's 4 weeks after the first dose, just take it.
4 weeks, is it, Doctor?
4 weeks after the first dose, and they should be recovered from the episode of COVID.
Okay. 11-year-old child infected with COVID, what medicine and precautions? But I guess this needs medical advice directly, but they're asking what do they actually give children who are infected with COVID?
Children rarely have severe symptoms. You just treat their symptoms. If there's fever, you give paracetamol. If they have cough, you give them a cough syrup. They almost never end up with severe COVID. So children are actually the easiest to treat with COVID.
A treated case of COVID, but cough is present since then for more than a month. So can the post-viral bronchitis that you mentioned, can that last for even a month?
Yeah, it can go on for a month, but a small fraction of patients, especially those who have very severe COVID, they end up on oxygen, ICU, etc., can go in for residual lung damage, residual fibrosis in the lungs. Usually the symptom for that will be shortness of breath or difficulty in exertion, etc. They won't be able to exercise, etc. So if cough is very persistent after COVID, see your doctor. Simple things like a chest X-ray or a pulmonary function test will be able to sort it out.
Is it safe to get vaccinated even if they have heart issues? And 3 months ago, an angioplasty was done. This has, of course, not exactly.
It's essential. If somebody has heart disease, they are at high risk from COVID. Take your vaccine now, today.
My brother took the first dose of the Covishield vaccine on 3rd May, but till yesterday, he's been having fever and cough. So is it, should it be COVID and should I get tested, or is it the vaccine? This is something which I have also seen quite a bit, where people get vaccinated after fever continues for more than 2 days, and then we wonder whether it's COVID or whether it's the vaccine.
Yes, you're right. Any vaccine related minor symptom like fever or body ache should go away in 24 hours. If it persists beyond that time, it's probably COVID. They might have been incubating the COVID when they went for the shot, or they might even pick up the COVID when they go for the shot if they don't follow proper social distancing or masking. So any persistent symptoms for more than 2 days after vaccine, please check for COVID. The scenario you described, probably that person has COVID.
So they should get tested.
Yeah, absolutely.
The cough is persistent after 10 days of COVID positive. The saturation and the BP is normal. Is it? Yeah, we already said that it cannot be infective. They're asking whether the persistent cough can transmit the infection to others.
No, you can't. After day 10, you can't transmit the virus to others. Even if your PCR test is positive, it reflects dead virus. So day 10, discontinue isolation. For cough, just take a cough syrup or a cough suppressant. That's all you need. If you don't have breathing difficulty, absolutely nothing more.
I'm under home isolation from 20th April. I was tested positive on the 28th. Now I'm still on isolation. Only thing I have is cough without any sputum. Should I retest or still stay in isolation?
You should not retest. You should not be in isolation. Go out and get some fresh air.
But this is, yeah, since 20th, it's a long time to be isolated. Well, this person is asking whether they finished their Covishield. Now they want to know if they can also take the Covaxin.
No, please don't. It's not, it doesn't, more is not merrier. We don't know the side effects if you keep taking vaccines. This is not candy. Take 2 doses of any of these vaccines, preferably the same vaccine, 4 weeks apart. Don't keep taking the vaccines. We don't know what it will do to you.
The Covishield is 4 weeks up to 8 weeks, isn't it? The gap, or is
that is true, but right now we are in the middle of an epidemic. It's better to finish off your vaccine early, which is 4 weeks. Earlier on in Jan, Feb, we were saying you could push that dose out too. But in the middle of an epidemic, it's more important to finish off your vaccine series.
Sir, I have taken twice the COVID test, one time rapid and second was the RT-PCR. Both times the result was negative, but I still have cough. What could be the reason?
A lot of other reasons. You need to see a doctor. You could have reflux. You could have something else. You could have sometimes medicines called ACE inhibitors can cause cough. So you need to see a doctor. If your PCR test is negative, you're still coughing. Even asthma can present with cough.
My mother took Covishield last Tuesday, but today she has 99 temperature and cough. Should she test?
Absolutely. It's not due to the vaccine. She probably has COVID.
We're just waiting for some more questions to come in. Yeah. We got our father vaccinated on 11th April. Post that, there's a slight cough. The second dose is due on 17th May. The vaccine is Covaxin. Is it okay to take the second dose because he's having cough?
Yes, just cough alone is not a contraindication to the vaccine, but it's a good idea to test and make sure that there is no incidental COVID before you take the second dose.
So if there is because we do hear of people asking about the second dose because they have something like a stomach upset or a slight maybe body, I mean, sometimes not even a feverish kind of a situation. So in what conditions, doctor, should they actually delay their second dose? Apart from being
dose should not be delayed unless you are sick. Say if you're having high fever, cough, or you actually have COVID, or you have some other medical problem for which you are in hospital, yes, delay your second dose. Otherwise, there's no reason to. We're in the middle of a pandemic. You really need that second dose. So please don't delay that second dose unless your doctor tells you don't. In general, take it on time.
Will people with thyroid disorders have side effects if they take the vaccine?
Absolutely not. Take it today.
But I was just wanting to ask you, doctor, myself, that, when we have a large number of people who take the vaccine across age groups or genders, or people who have, some of them are overweight, some of them are underweight, but then we don't know who actually gets severe side effects from the vaccine. I mean, there are people who you might expect, why do some people get high fever and body pain and all that, and some get absolutely nothing at all?
It's related to your immune system. Why are some people fair? Why are some people dark? It's all related to our genes. But in general, these vaccines, especially the Covishield vaccine, has been well studied abroad, where they have a good vaccine adverse event reporting system, and side effects are very minimal, comparable to any other vaccine like tetanus or polio or anything like that in general.
But there are people who have had, it may not last for more than a day or two, but it is high fever, severe body pain, and there are some who have nothing at all. Does it mean that the people who have nothing at all are not developing a good immune response?
No, it does not.
People
the
have
immune
this
response
doubt.
has nothing to do with a transient vaccine side effect like fever or body pain. So nothing to do. So you can have an excellent immune response without transient pain or vice versa. So just take paracetamol if you have body pain after the vaccine. Don't worry about the immune response. As per the studies, 70 to 90% of people develop a good immune response.
And there's no need to test yourself for IgG antibodies after your vaccine and all that.
So please don't go looking for trouble. Please don't test after a vaccine.
Sure, doctor. I think that's about all for now. So I know you're very busy in the hospital looking after the COVID patients. So I'm so grateful to you that you have taken out this time to answer the questions from our Facebook.
Welcome. Thank you very much.
And if you have, and viewers, if you have any more queries, you can reach out to us. Just put your comments or use Facebook Messenger, and we'll try to get back to you. Thank you very much, doctor. Tomorrow, we will have the topic of managing non-communicable diseases during COVID, and we're going to discuss heart disease. And this is going to be an episode with Dr. A. Srinivas Kumar, Director, Cardiology and Clinical Research, Jubilee Hills, Apollo Health City at Hyderabad. So we will be discussing this very important topic, so don't forget to join. But meanwhile, please take care and follow the cough etiquette, which Dr. Ram Gopal just explained to you. So if you do have a cough, make sure that you use a tissue when you're coughing or sneezing when others are around. Wear a mask. And if you don't have a tissue paper, at least try to cough or sneeze into your elbow and turn away from others. Make sure that once you use that tissue or once you cough, you wash your hands thoroughly with soap and water. and also with an alcohol-based sanitizer, and do throw the tissue paper into the trash can immediately, and immediately wash your hands or sanitize. This is what we call cough etiquette or respiratory etiquette. So if you do have a cough, don't panic, but follow these guidelines. Till we meet tomorrow, goodbye. And don't forget the SMS as always, that is social distancing, mask, and the third S, now you all know, and I think you should put the third S in your comments on our Facebook Live. Thank you so much. See you tomorrow, and namaste.